Autism is among the most alarming public health developments in history. There's never been anything like this. Just a few decades ago, 1 in 10,000 children had autism. So that's not a long time. And I've always heard, they say a few, but I think it's a lot less time than that. It used to be 1 in 20,000, then 1 in 10,000. And I would say that's probably 18 years ago. And now it's 1 in 31, but in some areas it's much worse than that, if you can believe it, 1 in 31. And I gave numbers yesterday. For boys, it's 1 in 12. I was told that's in California, where they have for some reason, a more severe problem. But whether it's 1 in 12 or 1 in 31, can you imagine? That's down from 1 in 20,000, then 1 in 10,000. And now we're at the level of 1 in 12 in some cases for boys, 1 in 31 overall. So since 2000, autism rates have surged by much more than 400%. Instead of attacking those who ask questions, everyone should be grateful for those who are trying to get the answers to this complex situation. And the first day all of these great doctors behind me were there, I told them, this is what we have to find out. Because when you go from 20,000 to 10,000, and then you go to 12, there's something artificial. They're taking something. And by the way, I think I can say that there are certain groups of people that don't take vaccines and don't take any pills that have no autism. That have no autism. Does that tell you something? That's currently, is that a correct statement, by the way?
There are some studies that suggest that, yeah, with the Amish, for example.
The Amish, yeah, virtually. I heard none. See, Bobby wants to be very careful with what he says, and he should, but I'm not so careful with what I say. But you have certain groups. The Amish, as an example, they have essentially no autism. First, effective immediately, the FDA will be notifying physicians that the use of let's see how we say that. Acetaminophen. Acetaminophen. Is that okay? Which is basically commonly known as Tylenol during pregnancy, can be associated with a very increased risk of autism. So taking Tylenol is not good. All right, I'll say it. It's not good. For this reason, they are strongly recommending that women limit Tylenol use during pregnancy unless medically necessary. That's, for instance, in cases of extremely high fever, that you feel you can't tough it out, you can't do it. I guess there's that. It's a small number of cases, I think. But if you can't tough it out, if you can't do it, that's what you're going to have to do. You'll take a Tylenol, but it'll be very sparingly. It can be something that's very dangerous to the woman's health. In other words, a fever that's very, very dangerous, and ideally a doctor's decision, because I think you shouldn't take it. And you shouldn't take it during the entire pregnancy. They may tell you that toward the end of the pregnancy, you shouldn't take it during the entire. And you shouldn't give the child the Tylenol every time he's born and he goes and has a shot. You shouldn't give a Tylenol to that child. All pregnant women should talk to their doctors for more information about limiting the use of this medication while pregnant. So ideally, you don't take it at all. But if you can't tough it out, if there's a problem, you're going to end up doing it.